Thank you, Ryan. And we're going to add it to the chat um, for if you can post your name, email address, if you have any questions, and then also what you're hoping to get out of today's webinar session. So please add that to the chat, and we'll give a couple minutes for to see if anyone else will be joining us. Thank you, Sean and Manette, for adding your email addresses to the chat. And then if you have anything that you're hoping to get out of today's webinar, please post that to the chat as well, and we'll get started here in a minute. Thank you, Caroline. I got your message from Ryan. Well, we can go ahead and get started. I imagine that people will drop in as we go. So we have an hour today. I don't think that it will take that long, but we are scheduled from 1:30 to 2:30. This is our first RFP webinar on strengthening rural health in Southwest Washington. My name is Ashley Gaffney. I use she, her pronouns, and I am the Community Health Director at Southwest Washington Accountable Community of Health, or SWATCH. We will be having another webinar session on February 5th from 12:30 to 1:30. So if you do have any additional questions, we'll have that session as well. And then you can also reach out to us if you have any other questions. Ryan, is that the grants email? Do you think you could add that email to the chat of where people can reach out if they have additional questions following this webinar? Prior to the other webinar, really anytime, feel free to reach out to us to ask those questions. And if we don't have answers to any specific questions today, we will get back to you. So thank you for posting your email in the chat. So for starters, I just want to open it up to see if anyone has specific questions. It looks like people are hoping to get a clear understanding of this opportunity, to confirm eligibility to apply, and we can go over those questions, but if anyone has any other questions they'd like to come off mute and ask or put in the chat, we can address those, and then I'll go through the request for proposal. This webinar is being recorded as well and will be uploaded to our website within 24 hours of the end of our session. And so too, if you need to go back and watch this video, you can find it at our website. It is linked right here on the request for proposal, southwestach.org/funding. And I believe I have that website. Yes, this is the website where it will be linked to that has all of our open funding opportunities. And if you scroll down, our Strengthening Rural Health in Southwest Washington posting is at the bottom here. The application opened January 6th and is open for 6 weeks and will be closing February 14th. And if you are to click on review application materials, this has the webinar dates. Again, the next one will be happening February 5th at 12:30 to 1:30 and will also be recorded and added to the website. Okay, I see the question about being a 501(c), not a 501(c), and asking about eligibility. Yeah, I would say so. Um, there is, and we'll double check as we are reviewing the request for proposal, but I don't believe that there is any specifics about the type of organization. So on the website, we've clicked on the Strengthening Rural Health RFP. If you go to review the request for proposals, that will pull up our request for proposal in a Word document, and this is what I will be reviewing today. So you're welcome to pull this up and go through it as we go, but I'll also be sharing my screen so that you can see it on my end as well. And hi, Claire, thank you for joining. We are just asking if you haven't had a chance to add your email to the chat. That way, if there are any questions that we're unable to answer here today, we can reach back out to you. And then if you could also post to the chat what you're hoping to get out of today's webinar. And we kind of just opened it up with any questions. And we got one question, but I think doesn't seem like there's any other questions, so we can move on in reviewing the request for proposal. All right, I'm gonna skip through the introduction and background and really highlight this specific request for proposal. If that is something that you would like for me to go into more detail about, let me know. Feel free to send me a direct message or post to the chat and we can go back through that later. Again, we do have an hour today and I don't think that reviewing this will take as much time. So whatever is going to be most useful for you to get out of today's session. Okay, thank you, Claire. Interested in learning more about the grant opportunity. There are a few community partners applying for funding, and it would directly impact and empower the Wellness Center. Yeah, thank you for sharing, Claire. Okay, so our objectives and intended outcomes. So we are seeking proposals for programs or initiatives to strengthen a robust rural health network of community and health-based organizations. And then to Manette's point, we are not specifying what type of organization, but are looking for organizations that have are community and health based. The objectives of this RFP is to sustain, improve, or develop an integrated care network coordinating behavioral health, so including mental health and substance use and misuse, with primary care services. In addition to that, we are seeking proposals that will advance models of integrated care. Some examples of that are co-location, telecare, behavioral health consultants, collaborative care, or a combination of models. I believe if you scroll all the way to the bottom in the appendix, there are definitions here for some of those terms. So, for instance, with co-location, this is a collaborative care model where a patient's primary care and behavioral health care providers are in the same physical location. And it can include shared staff, space, and equipment. So if you do have any questions about any of the definitions that are on this RFP, you can find those in the appendix at the bottom. I'm going to scroll back up to the top though. Um, I just want to say feel free to stop me at any time if you have any questions, or you're welcome to post any questions in the chat that you may have as we're going through this. The last objective is to increase access to care by overcoming barriers. Some of the barriers that we have listed here are from the Community Partner Survey that Swatch conducted in 2024. These barriers include staff workforce shortages, transportation, reimbursement rates, and stigma. This is not a fully inclusive list, so there certainly could be other barriers that your program or initiative is seeking to overcome, and that would be eligible for funding as well. And we just wanted to give a couple of examples of what we're hearing specifically from rural and somewhat rural identifying counties. The intended outcomes of funding would be to maximize collective resources by showing a commitment to partner with other community and health-based organizations to develop an integrated care network, to improve, sustain an integrated care network if one already exists, as well as support a workforce framework to build capacity by advancing models of integrated care and increasing access to healthcare services. And then lastly, to overcome the largest community identified priorities and self-identified barriers that are in the 2024 Community Partner Survey, which we, in the next session on rural health needs, do talk about more what those community identified priorities are. Again, these were community identified by rural or somewhat rural areas and include housing, mental health, substance use and behavioral health, access to health care, transportation assistance, food access, and child care. And then you can also see the chart of the largest self-identified priorities. It is kind of small, so I'll zoom in and hopefully you can see that better. And to note that we recognize these priorities and barriers are limited to the 33 responses that we've received from our rural or somewhat rural identifying community partners. So this is not an all-inclusive list, and we will still consider applications that do not include these community identified priorities or barriers. And with that, would just ask for, some explanation or description of how this is a priority or barrier for your community. And I'm just going to pause here for a minute to see if anyone has any questions before moving on with the request for a proposal. So we really try to make the request for proposals and funding at Swatch as low barrier as possible. If you have any specific questions about eligibility, feel free to ask them now or reach out to us and we can answer those. And we'll get into a little bit more of that further on the RFP. So again, the request for proposal due date is February 14th. It was released on January 6th. We will be having another webinar session February 5th. And then notifying successful applicants of funding decisions by March 7th. The plan is also to notify applicants that are unsuccessful, but it may not happen by that date of March 7th. But we do want to give feedback as we're able to unsuccessful applicants on their proposals. And I'm just looking at the chat, seems like we have some questions. Do different approaches and services for physical and mental health, a spectrum of care for youth qualify as collaborative care? Yes. Um, it's the integration of physical and behavioral health. And so, really, I think any approach to that is integrating those two services would qualify to apply. And yeah, hopefully I answered that question. Let me know though if you have a follow-up to that. All right. So additionally, we will be taking a period to onboard selected applicants of a quarter. So um, the contract term would start April 1st and April, May, and June. We would take that time to onboard any selected applicants, as well as provide technical assistance throughout the duration of the contract. The contract is for 12 months or 1 year, and so the contract term will end in March 31st of 2026. And at this point in time, because Swatch has a 2-year board approved budget, we don't have our budget past 2025. So I cannot guarantee funding past this request for proposal, though this is work that the Community Health Improvement Department is prioritizing. And so if we have funding, this is certainly something that we would like to continue past this year. Swatch is also responsible for convening community and health-based organizations to provide collaboration and support as needed. And we'll conduct an after-action review with staff and a committee within 3 months of the conclusion of the RFP process. The role of the partner with support from Swatch would include developing a workforce framework to describe and define the work and what workers need to know or be able to do to complete that work. And so this really goes back to our intended outcomes of supporting a workforce framework to build capacity. And additionally, a role of partner is to partner with Swatch and other organizations to maximize collective resources, which is another intended outcome, and demonstrate the impact of funding to the organization and the community served through activities, outcomes, or deliverables. Again, the contract duration, I'm just trying to find my mouse here, is for a year, starting April 1st of 2025 and ending March 31st of 2026. So there will be a period of time where, after we have notified successful applicants of funding decisions, March 7th, before the start of the contract. And our goal really is to get the contract executed, so signed with, any negotiations by April 1st. So we can get started on that work, because I'm sure, as you all know, a year is not really that much time, and we want to be able to support you all in getting started as quickly as you're able to. Now we're getting more into eligibility. And so the eligibility really does focus on defining what rural is, especially considering that we in Southwest Washington are including Clark County in this request for proposal. We wanted to parse out what could be considered rural in an urban county like Clark County. And so the eligibility really does specify rural areas. So it is limited to Klickitat and Skamania counties and rural Clark County, in addressing rural health needs. Again, going back to those community identified priorities or barriers. And if your application does not include one of the community identified priorities or barriers, just a description of how that is a priority or barrier for your community or organization. So Swatch, along with a selection committee for this RFP, worked on defining rural using the Community Foundation of Southwest Washington, the Census Bureau, an economic research service to define what rural is as far as for this RFP. And so Community Foundation of Southwest Washington uses the definition of rural to be an area that is historically under-resourced or lacking critical infrastructure. For this definition, we're asking that organizations elaborate on this definition if that's what they're using to define their area as rural. And then per the census, if the total population is 49,000, sorry, 999 or less, that would be considered rural. And we did add a table just below with population by county. As you can see, Klickitat and Skamania both have a population less than that. And so both counties are considered rural. Clark County has a population that is higher than that and is considered an urban county, though we know there are rural areas within the county. So for Clark County, we did break that down more using the rural urban commuting area primary code of 2. And what that means is a metropolitan area with a high commuting flow of 30% or more to an urbanized area. So this is just saying that there's a higher commute from these areas to an urban area. And below the table, there is a list of the cities and then their eligible zip codes that are categorized as a code of 2 under the rural urban commuting area code. And so I'm just going to pause here for a second so people can look at those cities and zip codes. So I think to note that really focusing on the zip codes and not just the city, because each city has one zip code that is considered to be or have a higher commuting flow to an urbanized area. I'm just going to pause if there's any questions about the eligibility. And you can feel free to come off mute or post any questions in the chat. Then down below, for more information about how funding decisions are made, there is an application and scoring matrix. So if you do go to the website, it will have this information for you. And then it also talks about how you can apply. Okay, so our scoring matrix is linked under how we evaluate applications. Did you have something you wanted to add? Ryan, I just saw that your video turned on.
I was just going to see if you wanted me to go over the application submission methods.
Yeah, I think that would be great to do right now.
Perfect. So we want to make this really low barrier for submitting your application. So there's three different ways that we'll accept those. Um, for a lot of folks, the easiest is a form application that we've built that will walk you through each field that we need to have information on. Um, it does allow you to save it, so you don't have to enter this all in at once. Um, so down at the very bottom, there's a link to save it, and when you save it, it will give you instructions on how to come back and access it later. Um, so that makes it relatively easy, but also we are accepting applications done through a Word document as well for folks that are more comfortable with that, which is linked in that Word document section as well. And then also, if either of those options don't work for you, you can also send us a video that highlights the different components of your proposal. This doesn't need to be anything particularly polished or um, professionally done. It can be very simple, recorded on a phone and sent over to us. We just ask that it talks through the different parts of the application. All of these are reviewed and weighed the same, so it doesn't matter which one you feel more comfortable with. And as you're working on these, if you have any questions or you run into any challenges with any of these options, you can always reach out to us at communications@southwestach.org. You can schedule a time to walk through it with you or answer any questions you have, either over the phone or Zoom or even just by email. So feel free to reach out if you run into anything that isn't working how you would like, or if you have any questions about the application, and we can assist you with it.
Thank you, Ryan. Next section, funding considerations. So in total, the funding that we have available for this funding opportunity is $900,000. All funding does need to be dispersed within the 2025 calendar year. And so we will work with successful applicants in dispersing those funds on a quarterly basis. The estimated number of awards is 4 to 6. So for each organization, the award amount is not to exceed 225,000. And if each organization was to be so 4 organizations, were successful for that full award amount, then it would be 4 organizations. But there are other organizations can apply for less than that amount. And so we did want to open it up to organizations too that may not need that full amount. And so up to 6 awards. And no less than 4. Okay, so for requirements, completing the application, Ryan went through the 3 different ways that you can submit your application, through the form submission, a Word document, or a video, as well as a submitted budget, which you can either include in your form submission or email that, along with a Word document or video. Um, and let's see, just pulling up the form survey. So this is where you would upload your proposed budget on the form survey. And it looks like this is a required question to complete. And so if you are filling it out via the form, you will upload it to that form and submit it with that. Okay. Selection criteria. So this talks a little bit about how organizations will be selected and who is involved in the process. So we do have a selection committee comprised of a SWOT director. That's me, the director of community health improvement. And then we have a minimum of 1 subject matter expert representing each county, for a total of 6 committee members that will be reviewing the request for proposals. We developed the scoring matrix and application, and that will be reviewing proposals. I will be reviewing proposals, but I will not be contributing to the scores of the proposals unless in an event of we are between 2 proposals, and we're unable to decide on one, then I would be that tiebreaker in that instance. But yeah, we will, as a committee, review the applications and use the scoring matrix to score those. So the proposals will be reviewed based on the application completeness and timeliness. So the submission is in by the application deadline, which again is February 14th. And if you happen to submit an incomplete application before that date, we will alert you that it was not fully completed. And then so you'll have an opportunity to finish your application and resubmit, as long as it is in by the due date of February 14th. And I am noticing, Ryan, just on here, it does say February 14th of 2024. That was a mistake that I made. And also just to point out, the webinar session on the timeline says February 4th, but that needed to be changed to February 5th. And so the date and time at the beginning of the request for proposal is the accurate date and time, and we can work on getting that updated, but just letting you all know. And if you need any further information, have any questions, please reach out. We want to change this to the communications email too, right, Ryan? So the communications email, I believe that Ryan posted in the chat earlier. If not, if you could please post that email in the chat. If you have any questions or would like further information. The scoring matrix, again, was developed by the selection committee, and from that, we created the application. So all of the questions on the application are questions that will be scored using the scoring matrix. And this is, to ensure funded projects or initiatives meet rural health needs and priorities of rural communities in Southwest Washington, which again are listed in the beginning of the application for community identified priorities and barriers. If your application is not including one of those, just a description on how that is a priority or barrier for your organization and the community that you serve. And then lastly, the cost reasonableness of proposed budget with a connection to the application. I talked about the timeline a little bit already. We will be, the selection committee that is, will be reviewing the applications 2 weeks following the due date of the 14th. So the last 2 weeks of February, the 17th through the 18th, we will be taking to review the applications individually and then together as a committee, and notifying successful applicants by March 7th, and then also sending feedback to unsuccessful applicants. Ideally, we would be able to do that by March 7th as well, but we may need to push that out for a later date in March. The contract start date is a few weeks following the notification of award to give organizations time to prepare, for us to work out the contract and any negotiations and signatures that are needed to move forward, and a onboarding process of a quarter from April to June, with continuous technical assistance and support from Swatch through the duration, the 1 year duration of the contract. And then I believe the last section is going over submission instructions, which Ryan talked about earlier, how you can submit your application. It is end of day, February 14th, so 11:59 p.m. Pacific Standard Time to get those applications in. That does fall on a Friday. It's also Valentine's Day. And so hopefully that'll be an easy date to remember. And you have the three options of submitting it on the form through a Word document or video. The video submissions should be 10 minutes or less. We don't have any criteria on how long the applications need to be, but as concise as possible to really help in reviewing those applications. And then at the bottom is the appendix with the definitions, and then an exhibit to proposed budget, which is linked in the on the website for strengthening rural health in Southwest Washington. That link through again the funding page, where you can find other funding opportunities as well. So if you have not been to our funding website, we do have another funding opportunity that is open right now until the 31st, collaborative funding. And they had a couple webinar sessions as well. And then continuously we have Swatch grants that open. And this is unrestricted funding to support community organizations throughout Southwest Washington. I'm gonna pause here. So it's 2:10. We have 20 minutes left. I'm gonna check the chat for questions. Ryan, do you have anything to add? Otherwise, I'm going to open it up to questions again. The question in the chat, does funding only cover activities in 2025? Or if hiring, for example, can it be planned to sustain a position for more than 1 year, even if dispersed in 2025? Yes, so um, you will get the funding in 2025, but you don't have to use the funding until the end of the contract term, which is March 31st of 2026. So you will have that first quarter of 2026, January through March, that you're able to use the funding. So in that example, for hiring, you could sustain a position for the full year. Thank you for the question, Carolina. And so I'm just going to pause for a second on this slide with the definitions for you all to look over, see if there are any questions about any of these. Um, but that is all I had scheduled for today. And so I am going to hang on for another 20-ish minutes until 2:30 to answer any questions that anyone may have. Yep, thank you, Carolina. But otherwise, thank you all so much for joining this webinar session. Again, we'll be having another one if while you're working on the application, you have additional questions. That one will be February 5th, and so you can feel free to join that one as well. I imagine that it's going to be similar to the one here today, unless we do have more questions. We'll open it up and we kind of have more of a discussion, but there is no need to wait. If you have questions sooner, please reach out to us at the email in the chat. I'm not seeing if you posted that. Oh, yeah. Thank you, Ryan. So it's the communications at southwestach.org. Thank you, Beth. Yeah, have a good day, Carolina. Thank you for coming.